So good morning to all of you. Okay, so students, how are the preparations going on? In full swing? And just a high-yield MCQs for you today, a final brush up before your exams. Let us discuss this. We'll start. Okay, here we go. So I'm Dr. Pradeep Pawar, Professor of Anatomy. Been teaching for the postgraduate entrances since last many years. Okay, just have a look at this MCQ. A high yield golden points for you students. Come on, answer this. A 40 years old male patient complains of dryness of mouth. On examination, there was absence of secretion from the parotid gland. Which cranial nerves carries parasympathetic fibers to the gland? Yes. Answer this. You can answer this. Even if it is wrong, it's fine. Do not retract your messages. Let us be interactive. Come on, students. What do you say? Which is the nerve which supplies the parotid gland? Which is the cranial nerve which supplies the parotid gland? Yes, that's the glossopharyngeal nerve. That's the glossopharyngeal nerve supplying the parotid gland. Okay, one moment. So that's the glossopharyngeal nerve which is going to supply the parotid gland. Parotid gland. Can anyone tell me what is the name of the nucleus of the glossopharyngeal nerve, students? The name of the nucleus of the glossopharyngeal nerve supplying the parotid gland. Anyone? Yes, anyone? The name of the nucleus of glossopharyngeal nerve supplying the parotid gland. This is just a final brushing before your exams, so try to answer whatever you can. What is the name of the nucleus in the brainstem which is going to supply the parotid gland? Okay. I'll just write this down for you. Okay. The name of the nucleus is inferior salivatory nucleus. Inferior salivatory nucleus. Okay, so that's the inferior salivatory nucleus. Inferior salivatory nucleus, that's the nucleus of glossopharyngeal nerve. It's not nucleus ambiguous. To supply the parotid gland. Mohit, nucleus ambiguous is going to supply the muscles of the third pharyngeal arch. For the glossopharyngeal nerve, जो है ना थर्ड pharyngeal arch को supply करती है, that nucleus is nucleus ambiguous. And the name of the nucleus of the glossopharyngeal nerve to supply the parotid is inferior salivatory nucleus. Just remember this, okay? Let this be there in your brain. This is extremely important. Yes, that's the inferior salivatory nucleus. You get the tympanic branch of glossopharyngeal nerve. This is a very important MCQ. You get the tympanic plexus. I'm just writing slightly faster. Tympanic plexus. We get a nerve here. What's this nerve? Lesser petrosal nerve. Lesser petrosal nerve. This is the lesser petrosal nerve. And this lesser petrosal nerve is a branch of, it belongs to which nerve? The glossopharyngeal nerve. Do you know a similar nerve? Do you know a similar nerve with a similar name? Petrosal? Like ये lesser petrosal है और कोई nerve है with a similar name. Come on students, come on. Any other nerve with the name petrosal in it? Yes. That's the greater petrosal nerve. Correct, that's the greater petrosal nerve. And this greater petrosal nerve is a branch of which nerve? Can anyone tell me the greater petrosal nerve? Lesser petrosal nerve is a branch of glossopharyngeal nerve. That's an MCQ. So the greater petrosal nerve belongs to which nerve? It's a branch of facial nerve. Greater petrosal nerve is a branch of facial nerve given in the middle ear. In the middle ear, that's greater petrosal. The lesser petrosal nerve is a branch of glossopharyngeal nerve. I hope this is clear to all of you. So from the lesser petrosal nerve, the lesser petrosal nerve gets outside the skull through a foramen. What's that foramen? Anyone? Yes, the lesser petrosal nerve gets out through a foramen. Name the foramen ovale. The foramen ovale now relays in a ganglion. What's this ganglion? That's a otic ganglion. And now the fibers will go to supply the parotid gland. The fibers would now go to supply the parotid gland. And who carries these fibers to the parotid? Can anyone answer this? Who carries these fibers from the otic ganglion to the parotid gland? Which nerves carry the fibers from the otic ganglion to the parotid gland? Come on students, come on, answer, be interactive. Which is the nerve which carries these fibers from the otic ganglion to the parotid gland? That's the auriculotemporal nerve. Auriculotemporal nerve. This auriculotemporal nerve is going to carry the fibers from the otic ganglion to the parotid gland. Doesn't mean auriculotemporal nerve supplies the parotid. No, the auriculotemporal nerve just carries the fibers to the parotid gland. Okay. And when there's a lesion of the skin over the parotid gland, when there's a perforating lesion of the skin over the parotid gland, now when regeneration is going on, when there's a regeneration going on, there's a mixing of fibers. Okay, there's a mixing of fibers. The fibers of auriculotemporal nerve gets mixed with the fibers of greater auricular nerve. Greater auricular nerve. So fibers of auriculotemporal nerve gets mixed with the fibers of greater auricular nerve when there's a perforating lesion of the skin over the parotid gland. Students, answer this. During regeneration, there's a mixing of fibers. The fibers of auriculotemporal nerve gets mixed with the fibers of the greater auricular nerve. Greater auricular nerve supplies the sweat glands also. And now when the person salivates, what is the person going to get? The person gets sweating of the skin over the parotid gland. Yes, and correct. This is what we call as Fraze syndrome. Fraze syndrome. So Fraze syndrome involves which two nerves? If that's the MCQ. The Fraze syndrome involves, yes, the Fraze syndrome involves which two nerves? The auriculotemporal nerve and the greater auricular nerve. Is this clear? Fraze syndrome. Okay, so these are all golden points. Fraze syndrome involves the greater auricular nerve and the auriculotemporal nerve. Students, if you can quickly tell me, crocodile tears involve which two nerves? Crocodile tears involves which two nerves? Anyone? Crocodile tears involves crocodile tears involve which two nerves? Come on students, answer. It involves which two glands? You can tell me. So when there's a lesion of facial nerve, above the geniculate ganglion, and when regeneration is going on, there's a mixing of fibers. The fibers going to the submandibular gland gets mixed with the fibers going to the lacrimal gland. There's a mixing of fibers. When there's a lesion of facial nerve above the geniculate ganglion, जब regeneration होता है, there's a mixing of fibers. The fibers going to the submandibular gland gets mixed with the fibers going to lacrimal gland. And now when a person salivates, the person starts to get tears. And this is what we call as crocodile tears. Crocodile tears. Perfect. Be clear about this. So glossopharyngeal nerve कौन से gland को supply करेगा? Glossopharyngeal nerve is going to supply the parotid gland. Correct? It is going to supply the parotid gland. What glands does the vagus nerve supply? Can anyone tell me? What glands does the vagus nerve supply? Vagus nerve supplies the glands of GIT. And what glands does the facial nerve supply? All the glands of head and neck. All the glands of head and neck. Except all the glands of head and neck except parotid. Okay, no? You know this. All the glands of head and neck except parotid. So vagus supplies the glands of GIT, glossopharyngeal nerve supplies the parotid, vagus supplies the glands of GIT, and all the glands of head and neck except parotid is supplied by facial nerve. All the glands, matlab all the glands matlab lacrimal, nasal, palatine, pharyngeal glands, the submandibular and the sublingual glands. Clear? Lacrimal, nasal, palatine, pharyngeal, submandibular and sublingual glands. So these are all the glands. Clear, students? And what is the name of the component required to supply the glands? Can anyone answer this? The name of the functional component which the cranial nerve should have to supply a gland. That's the general visceral efferent component. General visceral efferent. So general visceral efferent component of facial nerve is going to supply the glands. Perfect. एक और चीज बोलता हूं, कैन यू टेल मी व्हाट इज द नेम ऑफ द न्यूक्लियस ऑफ वेगस व्हिच सप्लाइज द ग्लैंड्स ऑफ GIT? What is the name of the nucleus of facial nerve? What's the name of the nucleus of vagus which supplies the glands of GIT? Come on, students. Anyone? The name of the nucleus of vagus which supplies the glands of GIT. बोल सकता है कोई? This is the dorsal nucleus of vagus. Dorsal nucleus of vagus. So the name of the nucleus of vagus which supplies the glands of GIT, that's the dorsal nucleus of vagus. And what is the name of the nucleus of facial nerve which supplies all the glands? That's the superior salivatory nucleus and the lacrimatory nucleus. Superior salivatory and the lacrimatory nucleus. Okay, that's fine. Perfect. Clear? Any doubts in this? Any doubts? We'll proceed to the next MCQ. Yeah. Answer this. Inferior parathyroids develop from which of the following pouches? Inferior parathyroids develop from which of the following pouches? Yes, answer this. Anyone? You can answer. I'm looking at the screen. You can answer. Even if it is wrong, it's okay. Please answer. Inferior parathyroids are developed from which of the following pouches? It's the third pharyngeal pouch. Third. Yes. And the superior parathyroids develop from fourth pharyngeal pouch. Okay. So the third endodermal pouch divides into a dorsal and a ventral part. The third divides into a dorsal and a ventral part. Clear? Third divides into a dorsal and ventral parts. Fine. The dorsal part forms what? The dorsal part is going to form the ventral part is going to form the thymus. So this is the third endodermal pouch. Third endodermal pouch. The ventral part forms the thymus and the dorsal part forms the inferior parathyroid glands. Ventral part forms the inferior parathyroids. And that's the fourth pouch. What is the dorsal part form? The dorsal part is going to form the superior parathyroids and the ventral part forms the ultimobranchial body. The ventral part forms the ultimobranchial body. And what is this ultimobranchial body give rise to? Anyone? What is this ultimobranchial body gives rise to? What is the ultimobranchial body give rise to? The parafollicular C cells of thyroid. Remember, students, the ultimobranchial body is going to give rise to the parafollicular C cells of thyroid, but recently it has been shown that the parafollicular C cells are derived from neural crest cells. You know this. I've told you this, the parafollicular C cells are derived from neural crest cells. अगर MCQ आता है parafollicular C cells of thyroid are derived from, your first answer would be neural crest cells. If that is not in the option, take the answer as ultimobranchial body. Am I clear to all of you? Is this clear? Be very clear. Parafollicular C cells of thyroid. Parafollicular C cells of thyroid are derived from. Your first answer would be neural crest cells. Neural crest cells. अगर वो ऑप्शन में नहीं होगा, then answer it as ultimobranchial body. Ultimobranchial. Suppose if both of them are there in the options, दोनों भी options में है, you take the answer as neural crest cells. Neural crest cells. Fine. Okay, very good. So that's about the. This is the third endodermal pouch. That's the fourth endodermal pouch. What about the second endodermal pouch? The second endodermal pouch forms what? Come on, students, answer. The second endodermal pouch is going to form what? Anyone? This you have to know. These are very, very fine points, very important things, golden points for you, high yield points for you. So the second endodermal pouch is going to form what, students? The second endodermal pouch is going to form the palatine tonsils. Palatine tonsils. Palatine tonsils. Okay, fine to all of you. Clear? Okay, that's it. See the next MCQ. A 60 years old male patient meets with a fracture of the neck of fibula. Fracture of the neck of fibula. Which of the following muscles would be paralyzed? Which of the following muscles would be paralyzed? Which of the following muscles would be paralyzed? Yes, answer this. Not accept. Yes. Yes, very good, Suraj. Very good. He answered correctly. So 60 years old patient meets with a fracture of the neck of the fibula. Yes, very good. The answer is C for this. How do you justify this? Which is the nerve which winds around the neck of the fibula? Come on, students. Which is the nerve which winds around the neck of the fibula? That's common peroneal nerve. Common peroneal nerve divides into a superficial peroneal nerve and a deep peroneal nerve. Clear enough? Common peroneal nerve winds around the neck of the fibula. The common peroneal divides into a superficial and deep peroneal. Superficial peroneal nerve supplies which compartment? That's the lateral compartment, and the deep peroneal nerve supplies the anterior compartment. Clear? Which are the muscles in the lateral compartment? Quick go through it. Muscles in the lateral compartment. One, peroneus longus, peroneus brevis. Okay, that's peroneus longus, peroneus brevis. And the muscles in the yes. The muscles in the anterior compartment would be tibialis anterior, that's the extensor hallucis longus, extensor digitorum longus, and peroneus tertius. Okay, so anterior compartment, tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius. Clear? So superficial peroneal nerve supplies the lateral compartment. That's peroneus longus and peroneus brevis. Peroneus longus and peroneus brevis. Tell me, students, who supplies the muscles in the posterior compartment of the leg? Come on, answer this. Which are the muscles which supplies which is the nerve which supplies the muscles in the posterior compartment of the leg? That's tibial nerve. And the muscles in the posterior compartment is gastrocnemius, soleus, and plantaris. That's one group. That superficial and deep group is tibialis posterior, flexor hallucis longus, flexor digitorum longus, and popliteus. So this is gastrocnemius, soleus, plantaris. Okay, this is the superficial group. Gastrocnemius, soleus, and plantaris. That's the superficial group. The deep group includes the popliteus, the tibialis posterior, the flexor hallucis longus, and the flexor digitorum longus. And which is the nerve of this compartment? Tibial nerve. The tibial and the common peroneal both are branches of what? Answer this. The tibial and common peroneal nerve both are branches of. This is a very simplified chart for you. Make such flow charts, revise it, making such flow charts, okay? Now sitting, you should be just quickly able to analyze this thing. So which is the nerve which divides into a tibial and common peroneal nerve? Anyone? The nerve which divides into a tibial and common peroneal nerve, it's the sciatic nerve. So here table should be there in your mind all the time. And the root value of sciatic nerve is L4, L5, S1, S2, 3. L4, L5, S1, S2, S3. So just going once again, sciatic nerve in the popliteal fossa divides into a tibial and common peroneal. The common peroneal nerve winds around the neck of the fibula. The common peroneal nerve divides into a deep peroneal and a superficial peroneal. Deep peroneal goes to the anterior compartment, superficial lateral compartment, and the nerve in the posterior compartment is tibial nerve. And you have to remember the muscles. Some muscles कौन से compartment में कौन से muscles हैं? Absolutely be clear about it. No confusion. No second thought. Right? And tell me, if the deep peroneal nerve is damaged, what happens? The dorsiflexion. इसका action क्या होगा? Dorsiflexion है ना? The action of this compartment is dorsiflexion. So it dorsiflexes. If this is lost, if this action is lost, the foot goes down. And what is that known as? Foot drop. That is known as foot drop. Okay. What is the action of this compartment? This is plantar flexion. Okay, the action of this compartment is plantar flexion, and this is eversion. Eversion. So action of this is plantar flexion and inversion. Inversion. Okay, plantar flexion and inversion. Posterior compartment does plantar flexion and inversion. The lateral compartment does eversion, and the anterior compartment does dorsiflexion. Perfect. Clear, students? Any doubts? Okay, I'll proceed. Okay, see the next MCQ. While studying the mediastinal surface of right lung, okay, a first prof student notices a vein over its hilum. Okay, right lung, there's a vein over the hilum. Something clicks to your mind. He identifies it as azygous vein. So it is already answered. The structure which arches over the hilum of the right lung, yes, that's a azygous vein. He further traces this vein and finds it opening in two. Okay, so where does the azygous vein open into? That's the MCQ. And your answer is brachio. No. Your answer is what? No. Mohit, what is the answer for this? The azygous vein drains into which vein? Anyone? Anyone? Come on, students. 2 days left for the exams. Come on. Brush up yourselves fast. अरे बच्चा, azygous vein opens into brachiocephalic vein नहीं है, my dear children. It opens into SVC. Azygous vein opens into SVC. Remember this, huh? Remember. Yes, azygous vein opens into SVC. The structure which arches over the hilum of right lung is azygous vein. The structure which arches over the hilum of left lung. Anyone? The structure which arches over the hilum of left lung. What is that vein? What is that structure? What is that structure which arches over the hilum of the left lung? Anyone? Okay, look at this quickly. Anyone? Bolo, you tell me the answer for this. This is the internal jugular vein. That's a subclavian vein. Internal jugular subclavian. That's the right brachiocephalic. That's the left brachiocephalic. No. That left brachiocephalic vein is longer. The left brachiocephalic vein joins with the right brachiocephalic and forms what? Ye kaun hai? This is the SVC. And what opens into this SVC is this vein. Ye kaun hai? Azygous. Azygous vein. That's the azygous vein. So azygous vein opens into the SVC. And this azygous vein is going to arch over the hilum of the right lung. Ye yaad rakhna, students. And the structure which arches over the hilum of the left lung. No, you have not answered it. No. The structure which arches over the hilum of the left lung is arch of aorta. You should be just quick with this. Arch of aorta. Structure which arches over the hilum of left lung. Arch of aorta. Right lung. Azygous vein. Yes. And what veins would drain into this azygous vein? These are the posterior intercostal vein. Posterior intercostal vein. I'll just make this for you, students. Come on, I'll just make this for you. So the first right posterior intercostal vein drains into what? The right brachiocephalic vein. The first left posterior intercostal vein drains into what? The left brachiocephalic vein. Now quick, go through it. The first right Posterior intercostal vein. This is the first, right. This would be the left. This would be the left. Posterior intercostal vein. This would be the left. The first left posterior intercostal vein drains into left brachiocephalic. First right posterior intercostal vein drains into right brachiocephalic. Second, third and fourth on the right side joins to form a vein here. Iska naam right superior intercostal vein. The right superior intercostal vein drains into azygos. Second, third and fourth on the left side joins to form. Iska naam hoga left superior intercostal vein, and this drains into the left brachiocephalic vein. Left brachiocephalic. All the veins on the right side drains into azygos. All the veins on the right side drains into azygos. On the left side, 5, 6, 7, 8. Students, this is very important. 5, 6, 7 and 8 left posterior intercostal veins joins to form a vein. बोल सकते हो, what is this vein? This is the accessory hemiazygos. Accessory hemiazygos vein. 9, 10, 11, 12 joins to form hemiazygos vein. So 5, 6, 7, 8 joins to form the accessory hemiazygos, and 9, 10, 11, 12 joins to form the hemiazygos, and both these veins will drain into azygos. Students, ये diagram should be imprint in your brain. This has to be there in your brain, students. Has to be there in your brain. This is very important. Perfect, bachcho? So the first right, first left. First right posterior intercostal vein drains into right brachiocephalic. First left posterior intercostal vein drains into left brachiocephalic. Second, third and fourth on the right side joins to form the right superior intercostal vein drains into azygos vein. Second, third and fourth on the left side joins to form the left superior intercostal drains into left brachiocephalic. On the right side, all the veins would drain into azygos vein. On the left side, 5, 6, 7, 8 joins to form accessory hemiazygos vein. 9, 10, 11, 12 joins to form hemiazygos vein, and both these veins would drain into azygos vein. ये बहुत इंपॉर्टेंट है. देखो आप बच्चों, how the accessory hemiazygos vein form है, that you have to know. How the hemiazygos vein form होता है, that you have to know. Is this clear? Any doubts in this? And the azygos vein drains into what? SPC. ये याद रखना. Azygos vein arches over the hilum of right lung. The arch of aorta arches over the hilum of left lung. This should be there. Very clear. Very clear. Okay, chalo. We'll go to the next MCQ. These are very high-yield MCQs, huh? ये आएंगे. They will come in the exams. Yes, they will definitely come in the exams. These are very high-yielding MCQs. Which of the following nerves supplies the inferior gemellus? Which of the following nerves supply the inferior gemellus? Yes, answer बच्चों. Answer. Anyone? Inferior gemellus. Anyone? 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 Come on, बच्चों, come on. Nerve to quadratus femoris. Yes, the answer is nerve to quadratus femoris. Very good, Suraj. Very good. It's a nerve to quadratus femoris. So the nerve to quadratus femoris supplies the quadratus femoris and inferior gemellus. Inferior gemellus. It supplies the quadratus femoris and inferior gemellus. And who supplies the superior gemellus? Who supplies the superior gemellus? Anyone? Can you answer this? Who supplies the superior gemellus? That's a nerve to obturator internus. Supplies the obturator internus and superior gemellus. Supplies the obturator internus and the superior gemellus. Yes, very good. Very good, Sadaf. So nerve to quadratus femoris supplies the inferior gemellus. Okay, can anyone tell me who supplies nerve to obturator externus? Ye kaun hai? Where does this nerve come from? Nerve to obturator externus comes from where? Who supplies the obturator externus? ये obturator externus कौन से compartment में है? If you can tell me, obturator externus, obturator externus, obturator externus. Which compartment is that of the thigh? Anyone? Which compartment of the thigh is it? Come on, students, come on. Exams are very close. Come on. Try to, it's in the medial compartment. Very good. So obturator externus is in the medial compartment of the thigh. And what is the nerve which supplies the obturator externus? What is the nerve which supplies the obturator externus? It's in the medial compartment of the thigh. And that's the nerve to obturator externus, which is a branch of posterior division of obturator nerve. Posterior division. It's in the medial compartment. Medial mein hai ye. Medial compartment of the thigh. Obturator externus is in the medial compartment, bachcho. It's in the medial compartment, and it is supplied by the posterior division of obturator nerve. Posterior division of obturator nerve. See if you can answer this quickly. Look, that's a greater sciatic notch. That's the ischial spine. That's the lesser sciatic notch. That's the ischial tuberosity. Ischial tuberosity. Clear? Now you tell me, students, what is this big pear shaped muscle which comes like this, which comes from the greater sciatic foramen? Ye kya muscle hoga? This is a big muscle which comes from the greater sciatic foramen. Can anyone answer this? And this is a muscle which comes to the lesser sciatic foramen. Anyone? Ye greater sciatic foramen hai. There's a big muscle which comes to the greater sciatic foramen. Come on, students, answer this. That's a piriformis. Perfect. Piriformis. And what is this muscle which comes to the lesser sciatic foramen? Can anyone answer this? Ye hoga obturator internus. Obturator internus. Okay. And now above the obturator internus, there's a worm-like muscle. Below the obturator internus, there's a worm-like muscle. बोल सकते हैं? Can anyone answer this? And there's a quadrangular muscle here then. This is the quadratus femoris. This is the superior gemellus, inferior gemellus. So piriformis, superior gemellus, obturator internus, inferior gemellus, and quadratus femoris. And which is the last muscle here? Ye kya muscle hoga? What is this muscle? Can anyone tell me this? What is this muscle here? This is the adductor magnus. In the thigh, ye thigh hai. This is a thigh now, so that's adductor magnus. Why am I telling you all these things, students? Why am I telling you all these things? Because I want you to know this. Can anyone tell me? Ye kaun hai? Who's this? Chalo bolo. This is a visual slide also for you. This is also a visual slide for you. Come on, students, what is this structure? I've drawn it in red, but the other color will not be visible for you. So you can just tell me what is this structure which comes below the piriformis. Anyone? This is a visual slide for you. This is going to be a visual slide for you. It's a nerve. I've drawn it in yellow because that yellow. I've drawn it in red because the yellow would not be visible. Iske liye I've drawn it in red. Abhi bolo. Ye bolo ab. Which is this structure which comes below the piriformis? It's a nerve. Piriformis hai. Mohit. It's in the posterior compartment. Femoral artery kaise hoga? Femoral artery is in the anterior compartment, hai na? Femoral artery is in the anterior compartment. This is in the posterior compartment. So now you tell me, which is the nerve? Which is the thickest nerve in the posterior compartment? It comes out in the gluteal region. It comes below the piriformis. The thickest nerve. with the root value L4, L5, S1, S2, S3. Abhi bolo. L4, L5, S1, S2, S3. Yes, that's the sciatic nerve. So that's the sciatic nerve. And all these muscles on which the sciatic nerve lies is going to form the sciatic bed. Remember students, sciatic bed is formed by which muscles? ये है ना, ये जितने भी muscles आपने लिखे हैं, these are all going to form the sciatic bed. This muscles. This is going to form the sciatic bed. So answer now, the sciatic bed is formed by what? 1. The superior gemellus, the obturator internus, the inferior gemellus, the quadratus femoris, and the adductor magnus. So this is what forms the sciatic bed. Does piriformis include in the sciatic bed? Is piriformis included in the sciatic bed? What do you say? Students, is piriformis included in the sciatic bed? Remain stable on one particular lecture. Don't keep on jumping here and there. Naito you jump from one lecture to the other lecture, you will not be able to follow. No, piriformis does not form the sciatic bed. No, because nerve है ना piriformis के नीचे आता है. देखो, the nerve comes below the piriformis. अगर ये piriformis के ऊपर आता था ना, तो then that would be forming the sciatic bed. I hope this is clear to all of you. Yes, this should be clear to all of you. Right? So everything is clear. So ये जो okay, that slide is gone. So the nerve to obturator internus जो होता है, it supplies the obturator internus and the superior gemellus. The nerve to quadratus femoris supplies the quadratus femoris and the inferior gemellus. Answer this MCQ. What is the action of genioglossus? Yes. Action of genioglossus. Protrusion of the tongue. So genioglossus is going to protrude the tongue. And remember students, the genioglossus is going to protrude the tongue to opposite side. Protrusion of tongue to opposite side. It protrudes the tongue to the opposite side. Just remember this. So the right genioglossus is going to protrude the tongue to left side, and the left genioglossus is going to protrude the tongue to right side. Is this clear? So it protrudes the tongue to the opposite side. So now you tell me students, if there's a lesion of the right hypoglossal nerve, if there's a lesion of the right hypoglossal nerve, who's paralyzed? The right genioglossus is paralyzed. Right genioglossus is gone. Who becomes powerful? The left genioglossus becomes powerful, and the left genioglossus protrudes the tongue to the right side. And that's how in lesions of hypoglossal nerve, the tongue will deviate to, answer, in lesions of hypoglossal nerve, the tongue deviates to the same side of lesion. Ye clear hai? In lesions of hypoglossal nerve, the tongue deviates to the same side of lesion. So the main action of genioglossus is it protrudes the tongue. It protrudes the tongue to the opposite side. In lesions of hypoglossal nerve, the tongue is deviated to same side of lesion. Genioglossus is also known as the safety muscle of the tongue. Right? Safety muscle of the tongue is genioglossus. You tell me, this genioglossus begins from where? From the superior genial tubercle. It begins from the superior genial tubercle of mandible. Superior genial tubercle of mandible. Is there a muscle which begins from inferior genial tubercle? Answer. Is there a muscle which begins from the inferior genial tubercle? Anyone? Genioglossus begins from the superior genial tubercle. Agreed. Fine. That's okay. Is there any muscle which begins from the inferior genial tubercle? Come on students, come on. Answer. अरे बच्चा जीनियो है ना, स्टाइलो कहां से आएगा? So superior genial tubercle से genio है ना, genio, glossus. So inferior genial tubercle से भी genio होगा, genio. Now complete the sentence, genio. Styloglossus will arise from the styloid process. Styloglossus is styloid process. Come on students, come on. Inferior genial tubercle से क्या होगा? Genio, genio, genio. Genial tubercle to the hyoid. Yes, that's the geniohyoid. You got this, geniohyoid. So inferior genial tubercle say, which is the muscle which arises? Geniohyoid. And why have I told you this specifically? Why have I told you this geniohyoid specifically? Why? Because it is supplied by whom? That is what I want you to know. The geniohyoid is supplied by, come on students, geniohyoid is supplied by, anyone? Anyone? Geniohyoid is supplied by, like, it's C1, fibers of C1. Geniohyoid is supplied by fibers of C1. Otherwise, who's going to supply? Geniohyoid is the strap muscle. No, it's an infrahyoid muscle है ना बच्चों. Infrahyoid muscle है ये geniohyoid. No, thyrohyoid is an infrahyoid muscle. Thyrohyoid is an infrahyoid muscle. Geniohyoid is a suprahyoid muscle, and this geniohyoid is supplied by C1. The other muscle which is supplied by C1 is thyrohyoid. Thyrohyoid. Okay, it's a thyrohyoid which is an infrahyoid. Geniohyoid is above the hyoid bone. It's a suprahyoid muscle, and this geniohyoid is supplied by C1. C1. Remember, fibers of C1. The infrahyoid muscles are supplied by ansa cervicalis, except thyrohyoid. Except thyrohyoid, which is supplied by C1. Except thyrohyoid, supplied by C1. Okay, come on, answer students. Yes, students. In this pandemic, a 40 years old office executive comes to the OPD with flattening of the thenar eminence. Okay, so the thenar eminence is flattened. Fine. On examination, with the dorsum of the hand placed flat on the table on the surface, the person is not able to touch a pen held above. Okay, so the person is with the dorsum of hand on the table, the person is not able to touch the pen above like this. The person is not able to touch the pen like this. So which of the following nerve is involved? Answer is median nerve. Median nerve. So what is this? What is this test known as? Like when you place the hand flat on the table and you take a pen and you tell the person to touch with the thumb. What is that test known as? What is that test? What is that test known as? Come on, students, answer, come on. It is known as the pen test. Pen test. And which muscle are you testing? Like if the pen is brought here, what is this action that you're doing? What is this action? Abduction. Abduction. So this is known as pen test. And which muscle are you testing by this pen test? The muscle tested is abductor pollicis brevis. The muscle is abductor pollicis brevis. Abductor pollicis brevis. And who supplies it? The median nerve. Abductor pollicis brevis, that's supplied by the median nerve. Median nerve. Clear to all of you? Abductor pollicis brevis, supplied by median nerve. Okay, posterior interosseous nerve is a branch of which nerve? Come on, answer students. Posterior interosseous nerve is a branch of? Posterior interosseous nerve is a branch of radial nerve. Posterior interosseous nerve is a deep branch of radial nerve. It's a deep branch of radial nerve. And what is the deep branch of medial nerve known as? The deep branch of medial nerve is known as anterior interosseous nerve. Anterior interosseous nerve. Okay, so this is pen test for abductor pollicis brevis. The nerve is medial nerve. So the medial nerve is injured. Coming to the next MCQ. lower 1/3 of the vagina is derived from? Yes, answer this. These are all high-yield MCQ students. You should know all these things, and definitely it will be there in your exams. I want you all to recall the questions after the exams. So lower thirds of the vagina is derived from? Anyone? Bolo, bolo. Lower 1/3 of the vagina is derived from the the lower 1/3. It should be the lower 2/3. That's actually a mistake. The lower 2/3 of the vagina is derived from. ऐसे mistakes भी होते हैं questions में. Upper 1/3 is derived from, yes, and the lower 2/3 is derived from something else. So it's the sino-vaginal bulbs. So lower 2/3 of the vagina is derived from sino-vaginal bulbs, and the upper mesonephric duct. What? The upper 1/3 of the vagina is derived from mesonephric duct नहीं है, it's the paramesonephric duct. Paramesonephric duct, students. So the paramesonephric duct forms what? The fundus, the body of the uterus, fundus, body, cervix, fallopian tubes, fundus, body, cervix, fallopian tubes, and the upper 1/3 of the vagina. Upper 1/3 of vagina. So all this is what in origin? This is mesodermal in origin. All this is going to be mesodermal in origin. Clear? So the fundus, the body, the cervix, the fallopian tubes, and the upper 1/3 of the vagina. All this is going to be mesodermal in origin. Mesodermal. So these are the two paramesonephric ducts. The two paramesonephric ducts fuse and they come and open into this. What is this now? That's the urogenital sinus. This is the urogenital sinus, and the urogenital sinus is derived from endoderm. Urogenital sinus is derived from endoderm, and that's the paramesonephric duct, which is derived from mesoderm. Paramesonephric ducts, which is derived from mesoderm. And now you get two bulbs here. What are these bulbs known as? What are these bulbs known as? This is what we call as the sino-vaginal bulbs. So sino-vaginal bulbs are derived from what? The sino-vaginal bulbs are derived from the urogenital sinus. And this urogenital sinus is what in origin? It's endodermal in origin. It's endodermal. So the lower 2/3 of the vagina is derived from the sino-vaginal bulbs, which is endodermal in origin. The upper 1/3 of the vagina is derived from the paramesonephric ducts. Clear to all of you? Upper 1/3 is derived from paramesonephric ducts, and the lower 2/3 is derived from the urogenital sinus. Urogenital sinus. Perfect. Perfect to all of you. Okay. What happens to the paramesonephric duct in males? Can you tell me? Paramesonephric duct females में क्या बनाते हैं? I've told you. Fundus, body, cervix, the upper 2/3, upper 1/3 of the vagina, and fallopian tubes. Quickly tell me, students, what does the paramesonephric duct form in males? It degenerates in males, it disappears in males, but it forms some vestigial structure. What is that vestigial structure? Anyone? It forms some vestigial structure. Gartner's duct nahi bacha. Ibrahim, no, it's not Gartner's duct. Gartner's duct is a remnant of mesonephric duct in females. Mesonephric duct in females है ना, वो Gartner's duct बनाता है. ठीक है, ये याद रखना, ये सब बहुत important MCQs है. So paramesonephric duct in females forms the entire genital system. ये ठीक है. Now this paramesonephric duct degenerates in males, but it forms two vestigial structures which are not functional. One is the appendix of testis, and prostatic utricle. Appendix of testis and prostatic utricle. Clear. So these are the remnants of paramesonephric duct in males. Remnants of paramesonephric duct in males. And remnant of mesonephric duct in females is Gardner's duct. Okay, it's the remnant of mesonephric duct in females. That's Gardner's duct. Okay, I hope this is clear to all of you. Students, before we go to the next MCQ, I'll just brief you about our platform. Just one moment. So we've come to... Okay, so we've got this plus subscription in which there are daily live classes, live quizzes, learning from the top educators, studying from the device of your choice, and access to a 25,000 plus MCQ from the bank. An iconic subscription where you get the best of Unacademy and pre-platter. Special class features in which there are interactive live class, poll for the learners, raise a hand technique, never miss a class with proper notifications being given on time. And lecture notes, if you miss the class, you get this lecture notes, you get recorded lectures, and anytime, anywhere you can access the class and get your doubts solved, students. A highly effective and updated question bank has been prepared with detailed explanatory answers, specially for you. And these are our last NEET PG toppers. They have got excellent ranks in the exams. We congratulate all of them once again. Yes, raise a hand technique in which if you press the icon, you can directly talk to the educator. Get your doubts solved there and there itself. Students, now there are some free tests that Unacademy is offering for you. It's a ritual test every day, same time, same day the tests are conducted. So it's like a ritual registered in your brain. Here we have educated curated test series. It's a subject-wise test prepared by the educator himself or herself. Wednesday 9 p.m. It's a subject-wise test. FMGE Grand Test, Wednesday 9 a.m. and 2 p.m. Study with me, YouTube test series, Friday 9 p.m. Saturday special class marathon batch, it's Saturday 9 p.m. And Grand Test for all our courses, it's Sunday 9 a.m. Okay, just remember this, it's a ritual for us. Now we're coming with the NEET PG 2022 Ultimate Revision Package. 3 modules you can have a look at the website, the details are there. Starting from 10th of December to 10th of March, 3 months just before the NEET PG. Yes. Focus FMG 2022 Comprehensive Batch. We're starting from 13th of December, a comprehensive batch for the FMG. Students, the NEET PG Compact is here once again, 19th December. Spread this word to your friends. And all of you can also attempt this 19th of December, 5 p.m. Don't forget the date and time. Once again, 19th of December, 5 p.m. 45 MCQs, 60 minutes. Okay, 45 MCQs, 60 minutes. Lot of prizes to be won. Scholarships to be won. Amazon vouchers to be won. Wow, it's great. So you can always avail this offer. Scholarships will be there. You can get a free subscription also. Download the Unacademy app and subscribe to it. Okay. Now we come back to the MCQ. Here we are. Answer this. So 6 years old male complained of pain in the pectoral region. On examination, a soft tissue swelling of pectoralis minor was noted. On MRI scan, it was further revealed that it was compressing the axillary artery. Alternate blood flow is maintained by anastomosis between... Anyone? 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 Attempt this. Deep branch of transverse cervical and subscapular. You're not confident, Mohit? Be confident. Be confident. Yes, the answer is C. Answer is C for this. C. Deep branch of transverse cervical and subscapular. Deep branch of transverse cervical and subscapular. Just understand this MCQ. Just understand this. One moment. Dekho, your first strip, students. That's the first strip. And quickly tell me, which is this artery which crosses the first strip? Which is this artery which crosses the first strip? and continues as so this is axillary artery. So which is this artery which crosses the first rib and continues as axillary artery? That's a subclavian artery. अगर ये axillary artery है, what is this muscle which is going to divide the axillary artery into 3 parts? And अगर ये subclavian artery है, what is this muscle which is going to divide the subclavian artery into 3 parts? Can you answer this? Yes, students. What is this artery? What is this muscle? Scalenus anterior. Scalenus anterior, and that's a pectoralis minor. So that's the first part, that's the second part, that's the third part of the subclavian artery. That's the first part, that's the second part, and that's the third part of the axillary artery. Yes, समझ में आया students? So this is the subclavian artery. The moment it crosses the first rib, the subclavian artery is now known as axillary artery. ये clear है ना? I'll just write this down for you. So this is the subclavian artery, and this is the axillary artery. Subclavian and axillary. So subclavian artery is divided into 3 parts by the scalenus anterior. Axillary artery is divided into 3 parts by the pectoralis minor. Now students, if there's an obstruction, देखो, if there's an obstruction in the second part of the subclavian or the third part of the subclavian, obstruction in the second and third part of the subclavian, or there's an obstruction in the first and the second part of the axillary artery, the blood will flow from the first part of the subclavian artery to the third part of axillary artery. The blood will directly flow from the first part of the subclavian artery to the third part of the axillary artery through this anastomosis. Okay, so that is the importance of knowing this anastomosis. If there's an occlusion of the first and the second part of subclavian, or the second and the third part of the subclavian, or the first and the second part of axillary, the blood will flow from the first part of the subclavian to the third part of axillary. Which branch of subclavian? That's the deep branch of transverse cervical, a deep branch of transverse cervical and suprascapular, and this is subscapular. So deep branch of transverse cervical and suprascapular. These are the branches of the first part of the subclavian artery, and which is the branch of third part of axillary artery? That's the subscapular artery, subscapular. So that's how the anastomosis is between. So you see what is the option given? Answer accordingly. Okay, students, quickly can you go through the branches of axillary artery? Axillary artery is divided into 3 parts by whom? Pectoralis minor, which is the branch from the first part, 8 branch, second part 2 branches, third part 3 branches. Artery should be perfect, students. Answer, artery has to be perfect. First part ka 1 branch, naam the superior thoracic artery, Second part ke 2 branches, lateral thoracic and thoracoacromial. And third part gives 3 branches, anterior circumflexhumeral, posterior circumflexhumeral and the subscapular artery. Anterior circumflexhumeral, posterior circumflexhumeral and the subscapular artery, subscapular artery. Is this clear to all of you? Perfect, students, perfect. Any doubts? Students? कुछ doubts है तो बोलो. So I'm done with this for today's session. Revise everything. Don't be stressed. Have a good sleep before the exams. Okay, you be fresh. You've been studying very hard since so many days, and I'm sure you'll get a very good results. Okay, you will definitely get good ranks, good results. Okay, only thing is that revise everything once again. The blood vessels extremely important, and put a special emphasis on the upper limb, the abdomen, the head and neck. Okay, and we've been discussing MCQs since so many days now. You have an idea of all those things. फिर भी कुछ डाउट्स हैं, if anything is not clear, you can anytime WhatsApp me or you can send a mail PAWARPRADEEP@gmail.com. Okay, I'm Dr. Pradeep Pawar. So 9869007394 PAWARPRADEEP@gmail.com anytime. Okay, and all the best students, all the best for your exams. God bless you all. Do well. So let us meet once again for the NEET PG. Okay. Anything you would like to ask, anything you would like to say, you can. Okay, so thank you to all of you. Thank you to all of you. And all the best once again. All the best. Thank you to all of you. I'll stop here. Thank you and all the best. I'll stop.